Light here for our sponsor, Knowles Caravans, and you're listening to Friday Coast Magazine with Brenton and Shiona on 88.7 Adelaide's Coast FM.
You most certainly are. Time here at Coast FM, 11:15.
And welcome back to Coast Magazine. Since Brenton and I started Friday Coast Magazine a year ago, we tried to concentrate on charities and things like fundraising activities that get very little recognition from the government. And one came to my attention a couple of weeks I'd never heard of, and I wanted to find out more about it. It's called Butterfly Children. That's not the proper name, but I would like to welcome on the phone this morning Dr. Kopecki and Laraine Frost. Dr. Kopecki is the person who's more or less in charge of research in South Australia, and Laraine is going to talk from a family point of view. Welcome to Coast FM.
Hi, thank you for having us.
That's our pleasure. Thank you for being here. Dr. Kopecki, we will talk about the butterfly children in a moment. It's taken me a while to learn how to pronounce the genetic disease that starts that. Epidermolysis bullosa, it's called, better known as EB. Can we call it just EB for the moment?
Yes, that would be fine.
It's easier. It's an amazing illness, and they call it probably the worst disease you've never heard about. To give it such a pretty name, Butterfly Children, is rather strange. But could you tell us just a little bit about the disease before we get on to you yourself?
Sure. So EB is a skin blistering condition. It is the babies that have it are called butterfly children because their skin is as fragile as butterfly wings. So basically they're missing proteins in their skin that keep the skin layers together. And what this leads to is really to severe blistering all over the body of the skin and the mucosal surfaces. So not just the skin but also the gastrointestinal tract. And there are four main types, and they can range from mild disease to very severe disease. So in very severe cases, the disease leads to widespread blistering, and it's really referred to a lot like having third-degree blisters and third-degree burns, just to give you an idea of the pain and suffering that these kids go through.
Now, you completed your undergraduate and postgraduate studies here at the University of Adelaide. Your achievements over the past years are really quite phenomenal, but you've centred on developing novel therapies for patients with skin blistering diseases. Can I ask you what led you to that particular field?
My undergraduate degree was in laboratory medicine, and I've always enjoyed pathology. So skin was kind of a natural extension of that, being our largest organ. I was always interested in skin conditions, and I did my PhD specializing in skin blistering diseases, and subsequently devoted my career to trying to develop treatments and improve diagnosis of EB. One problem we have is with the mild patients, they get misdiagnosed because we don't have adequate ways to diagnose the disease at the moment. And then with the severe ones, they're so severe that we really need new treatments to help ease some of the symptoms that are caused by this disease.
Now, your achievements have been recognised by the Channel 9 Young Achiever Semi-Finalist Award, the Young Investigator Runner-Up Award, the Science and Excellence Finalist Award, the South Australian Tall Poppy Award finalist. That's amazing. And you've studied at the Medical Centre of Freiburg in Germany, and you're an honorary research fellow at the Centre for Cutaneous Research at Queen Mary's School of Medicine, London. That's a lot of achievements to fit into a few years.
Yeah, it's been a busy 10 years, I think.
When you think about it, it has been very busy for you. Now, in 2013, you joined the Centre for Regenerative Medicine at the Mawson Institute as a research fellow, where you can continue to develop. And this is, I guess, how you became involved with DEBRA SA, which is, of course, the fundraising side for EB. How did you get that involvement?
That's right. So I spend my days in the laboratory trying to develop new treatments to help these children, but in my spare volunteer time, I like to volunteer my time with the DEBRA charity, which is the patient charity that helps these patients. I got involved by meeting Laraine, actually, back in 2009, and the more I learnt about it, really I just got more and more involved over the time, and now I'm one of the directors for DEBRA Australia and also on the executive board of the international DEBRA committee. So it's been a really valuable journey for me personally and professionally. It also helps us understand the disease better and understand what these patients are going through and kind of get a concept to who we are developing these therapies for. It just gives us more drive to work harder and develop something.
It's estimated that there are around 1,000 people in Australia who have some form of EB, and over 500,000 worldwide. So it's not a huge span, is it? It's quite a unique.
Disease, but you're right. There's about 1,000 patients in Australia, and probably of those, there are 100 or so that are very severe.
And it occurs in all racial and ethnic groups, and males and females. It's not choosy.
No, it's a genetic condition. There's about 15 different proteins in the skin that can lead to mutations in 15 different genes that can lead to these proteins not working properly and causing skin blistering. But as you say, it is equally spread among males and females.
And I understand that there's no way of testing if a lady is pregnant to know whether her baby will have this disease, is there?
There has been an improvement in uterine testing. So we do have a way to test, but we only test those that have a family history or that are at high risk of having a child with EB.
Because the birth process would have to be extremely delicate not to damage the baby, wouldn't it?
That's correct, yes.
Yeah, it's quite and now, there are various, I understand, I'll talk to Laraine in a moment because she, of course, has a family history with this. With the different, there are some quite simple types, and, of course, there are the very serious types.
That's correct. So basically, our skin has kind of two main layers that are joined together, and it depends which protein or gene is affected and where the blisters are. So, for example, in Laraine's family, they have a milder form of the disease because the blisters are in the top layer of the skin. They're very superficial. So even though they occur, they heal quite well. But patients that have blistering that's more deep at the junction between the two layers or deeper down in the dermis, which is the second layer, that's where the consequences are very severe, and patients end up getting skin cancer and generally have a life expectancy of about 50 years of age. And
is this where your research into, they say novel forms, but different alternative forms of dressings and things like that, is that where that becomes really important? That's correct. So at the moment we have two kind of main studies. One is a clinical study that Laraine was actually involved with that looked at how we can improve the diagnosis for very mild patients, because at the moment, even though it's a rare disease, lots of the patients that have mild disease don't get appropriate diagnosis and support system because they get misdiagnosed for having eczema, for example. So that's one aspect. We're trying to develop a better, minimally invasive, pain-free diagnosis for these patients. Other aspect of our research is trying to develop dressings that have antimicrobial properties. So at the moment, one of the common dressings that's used by these patients is dressings impregnated with silver, because silver has antimicrobial properties. The problem with that is that over the years, silver can be quite toxic to the body, and patients can only use it for a short period of time. So even though these dressings have been available for a long time, they also have a negative effect on the patients. So we're trying to develop new dressings that can eliminate infection by delivering a smaller amount of silver and in such way that is not toxic to the body. Sounds so. I'll just swap over to Laraine for a moment. Laraine, you've lived with this. I guess your husband and quite a few members of his family have it in varying different forms, don't they?
They do, actually, Shiona, yeah. None of them are the same, but they all simplex, yeah. They all suffer differently. I mean, my husband will play golf, but invariably he will get blisters, especially in the summer. That's obviously, it's just more friction, I guess, then. Can I just say, too, I know Zlatko mentioned DEBRA. which is the organisation, the international organisation, but DEBRA is an acronym for Dystrophic Epidermolysis Bullosa Research Association. So
Oh, you do that very well.
from a lass in England who was named Deborah, and when she passed away, her mother started a fundraising or an awareness for this, and so we've carried it on, and that's been going now for over 40 years, I think, yeah. So.
And DEBRA has quite a few, I guess you could say, goals that they have. I mean, they have their EB nurse program, their research programs, their family support program. So their work must be vitally important to families like yourself who are living with this disease.
Oh, it is. It's all good. We also have Kate Turner Fund, which is, unfortunately, Kate died nearly 5 years ago, but we set this up in her memory before she passed away, so remember. And any of our EB families that's butterfly children can apply for a grant up to $5,000 per year. So we are fundraising for that in South Australia quite strongly, and we get lots of support in that. But,
there's actually a YouTube video, isn't there, that explains more about this?
Sorry?
The Kate, the link that you sent me
yes.
about the Kate video on YouTube that people can look at, and it gives them a really high understanding of just what families are going through.
That's right.
Mm. And
there's also quite a lot of information on the DEBRA website, so we would encourage all the listeners to log on and go to debra.org.au and kind of find out more information about the disease and potentially donate to help us fundraise and support these families.
DEBRA, what is your involvement, Zlatko, in sort of the running of DEBRA? Does it take up a great deal of your time?
It does, actually, but I do it as a volunteer, and I'm one of the 7 directors. So basically, my main involvement is in the Research and Education Committee, but also in the marketing and fundraising. So as you can imagine, we just try to do everything we can to make sure that the charity is sustainable and that we can continue to offer services to families. There's about 300 families that access DEBRA support. And this can be anything from minor things like supporting family support program that offers support when babies are born, when children die, offers medical support that's outside of the national EB dressing scheme. So that's one aspect. The other aspect is educating health professionals about this rare condition and trying to organise events to fundraise to be able to provide this support and continue to support research.
And Laraine, you've just finished a fundraising walk. Is that right? How did you go?
I know that's the PB for EB, which is a personal best for EB, and I have been challenged that I have to walk 10,000 steps every day for the month of May. And I think one of my friends actually made a donation and challenged me to last a bit longer, but I'll see about that. But also, I'm given up. I'm having a dry month, so I haven't had any alcohol.
No wine with dinner, no.
I'm finding the steps a lot easier.
A lot easier than the giving up the wine. Well, it's.
So, yeah.
We've been really thrilled at DEBRA how many patient families are getting involved with this PB for EB challenge and doing things that can, improve their health, but also help and a way to fundraise for DEBRA. And you can imagine, Lorraine's walking really long distances, and luckily we're in winter and not in summer, because lots of these patients walking for a long distance would cause severe blistering of the feet.
Well, it's probably come at quite a good time with everyone isolated at the moment. It's giving Laraine an interest to get out and do the walk rather than some of the other things that we get up to in a normal. Yeah. So it's
fundraise for DEBRA while I'm enjoying myself, actually.
Well, that's right. It's a double fold. Look, thank you both for coming on. It's a disease that, as I said, I had never heard of, and I'm sure a lot of our listeners had never heard of it. I encourage them to go on your website because it really is a good website. lots of information, and they can get it right from the horse's mouth, more or less. Good luck with your research work, Zlatko. It sounds like you enjoyed immensely, and you're getting wonderful achievements, and that can only be commended.
Thank you,
Thank
Shiona.
you.
That's right. Thank you for giving us your time. I know it's a difficult time, and I know you're busy, but I'm sure our listeners do appreciate. And as I said, they can just pop on the website, find out what they want to know. They can join DEBRA if they want to as a supporter, and it definitely should get more support. So thank you for that, and maybe we can talk to you again later on in the year and see how you're going.
That'd be wonderful.
That'd be great. Thank you.
Thank you very much. Thanks. Bye-bye.
Thank you.
G'day, Blighty here. For